everyone. Welcome to Exploring Healthy Mind with me, Omowale Adebowale. On today's session, we're going to be discussing depressive disorders. Before we go on to talking about depressive disorders, I would like to say thank you to you as you continue to watch our videos and as you continue to like and subscribe to the channel. I'd like to say a huge thank you to you. If you enjoyed today's session, please watch it to the end, and at the end of the session, please like the video, subscribe to it, and please share the video with one or two people that you know might be able to benefit. Last week, I know that there was a couple of mix-up with the telephone numbers as they were being read out. I'd like to reinforce again that our free phone telephone number is 0800 00 96241, and this telephone is open to you to call 24 hours in a day if you need our help or our support for one thing or the other in relation to your mental health or perhaps your family well-being. And I'd also like to encourage you to please visit our website www.fsfaministries.org. On that website, there are also some resources that you can find useful, and on our contact page, you can either self-refer yourself or you can refer someone as a third-party referral. Thank you for watching. Stay tuned. In today's session, we are going to be talking about depressive disorder, and there are four main things that we are going to be talking about today. We are going to try to understand what depression is. We want to try and recognize when we need to ask for support if we are depressed, and we also want to learn to recognize when others around us need support. And lastly, we'll be discussing management tips for depression. When we're talking about depression, what exactly are we talking about? Is depression just a form of low mood? Or is it just a period of unhappiness? Or a form of weakness that an individual cannot overcome? What exactly is depression? But I'd like to let you know that depression is a form of mood disorder. It is characterized by feelings of low mood, feelings of loss, feelings of sadness, and sometimes feelings of anger that then go on to interfere with an individual's everyday life. Going through a distressing or traumatic life event can make one become very upset, sad, or low in mood. But sometimes these feelings of low mood can suddenly happen without any obvious reasons. Feelings of low mood are an integral part of our everyday life, and they can sometimes manifest as symptoms of tiredness, weakness, feeling frustrated, symptoms of anger, or losing pleasure in things that you normally derive pleasure from. For most people, these feelings will pass after a couple of days or weeks, while for some people, these feelings of low mood tend to linger on, and they tend to occur regularly and often without any obvious reason, as we have said, leading them to feel down or hopeless. When then do these feelings of low mood go on to become a depressive disorder? An individual can be said to be suffering from depression if their feelings of low mood, anger, or unhappiness linger on for several weeks, then leading to a loss of pleasure in things that they normally find pleasure in, or when this feeling starts to interfere with their daily work, their relationship, or their daily activities in general. Depression is a serious medical condition that often tends to get worse if left untreated. What are the symptoms of depression? Different individuals tend to have different symptoms to describe their feelings of depression, but some of the most common symptoms of depression include sadness, worry, anxiety, panic, tiredness, a lack of self-confidence, feelings of frustrations, feelings of irritability, feelings of anger, losing interest in things, or you might begin to notice that you start to withdraw from your usual activities, particularly spending time with loved ones, or spending time with, doing things that you used to enjoy or things that you used to value, or you might start to notice that you are having trouble sleeping. What are the causes of depression? For some people, depression can be tied to a traumatic event that has gone on in their life or a health issue that they are going through at the moment. But in most cases, the cause of depression for individuals just can't be explained. But there are some very common causes that we're going to be talking about today. First, family history. When people have a family history, like parents that have suffered from depression, it can put them at a high risk of them going on to develop depression in their own lives. Early childhood trauma. When somebody has been exposed to traumatic or stressful events in their early years, put them at a risk of going on to developing depression when they grow up. Also, the regular use of certain medications such as benzodiazepines and hormone replacement therapy drugs can put individuals at a risk of developing depression. And lastly, the misuse of drug and alcohol can also increase your risk of developing depression. About 21% of people who have a substance misuse problem can go on to develop depression later on in their life. Other common causes for depression include a low self-esteem, a personal history of mental health issues, going through stressful life events such as the loss of a loved one, financial problems, relationship issues can also put you at risk of developing depression. Depressive disorders are generally classified into two major categories based on the severity of their symptoms. The first category that we're going to be talking about is known as major depressive disorders. This is the severe form of depression, and it is usually characterized by feelings of sadness, hopelessness and worthlessness that persist unless they are treated. For an individual to be diagnosed as having major depressive disorder, the individual must have had at least 5 of the symptoms that we are going to be talking about ongoing for a period of two weeks. So for that person, they'll be experiencing feelings of depression every day, most of the day. They would have experienced feelings of losing interest in most of their regular daily activities. Individuals with major depressive disorder would also have been continuously experiencing significant weight loss or weight gain. They will be having regular sleep troubles. They will have slowed thoughts or movements. They will be experiencing fatigue or low energy for most of the days. Feelings of worthlessness and guilt tends to persist for such individuals. They lose their concentration and they become indecisive. And for those individuals, they tend to have recurring thoughts of death and suicide. The second category of depression that we're going to be talking about is referred to as the persistent depressive disorder. This is generally referred to as the milder form of depression, but it can be a very chronic condition in the sense that it tends to last for a longer period. For an individual to be diagnosed of having persistent depressive disorder, that individual would have been experiencing these symptoms for a period of 2 years. And the symptoms that we are talking about, they are closely related to symptoms of depression, but they are usually symptoms like losing interest in your daily activities, a feeling of hopelessness that has been ongoing for a period of 2 years, losing your productivity at work, a feeling of fatigue and tiredness that has been persisting for a long time, and then having a feeling of low self-esteem that has been ongoing for a period of 2 years. How is depression treated? First, I would like to put your mind at rest if you happen to be having feelings of depression, to let you know that depression can actually be successfully treated. But in order for you to successfully treat depression, you need to be fully on board, you need to be very cooperative and stick to whatever treatment plan that you have been given. Treatment for depression usually involves a combination of psychological therapies and pharmacological treatments. And when we are talking about pharmacological treatment, it is the use of medications such as antidepressants and anxiolytic or medications for anxiety. And in certain cases, it could be a use of antipsychotic medication, which have also got that ability to stabilize your mood. And you can find that your mental health practitioner, your mental professionals might prescribe for you such medication to use in order to be able to stabilize your mood. Psychological therapies such as psychotherapy, cognitive behavioral therapy can also be used to help challenge unhealthy thoughts and help you think positively and reflect on your feelings. and also they can help you to learn coping skills to be able to challenge your negative feelings. The use of exercises can also be very, very productive in helping to treat your depression. Having at least 30 minutes of physical exercises for between 3 to 5 days a week can help increase your body's production of hormones that are responsible for stabilizing your mood. These hormones are referred to as endorphins. And also getting involved in other helpful activities that you find that you derive pleasure in. It could be a hobby or anything that you enjoy doing, can also help you to overcome your feelings of low mood. Looking after yourself is a very key part of being able to overcome your depression. Take each day as a time. Don't hurry things. Don't try to do a lot of things at a go. Don't try to be a superwoman. Take a break when you need a break. And if you feel like things are getting too much, ask for help. Try to get a very good sleep. At least 8 hours of sleep every night is very important. Don't overdo it. Don't sleep too much, but make sure that you are getting good sleep regularly. Healthy living. Eating a very healthy and well-balanced diet is key also to improving your physical health and as well as maintaining a good positive health for you. I cannot overemphasize the importance of talking. On every session we say that you need to talk. Talking is the way to help you to balance your mental health. When you find that you are becoming too overwhelmed with things, when you find that your feelings of depression are becoming too overwhelming, it could be very, very helpful for you to find somebody to talk to a friend, talk to a family, join a networking group, or pick up your phone and call a helpline where there will be somebody waiting to speak to you at the end of the phone. And avoid alcohol and drugs. Drug and alcohol misuse can worsen your symptoms. It might feel like when you drink, you might feel like your problems are being solved at that point in time, but when you then overcome that, when the feelings of the alcohol wears out, it can actually worsen your symptoms. Lastly, learn to say no. Don't overwhelm yourself by taking on too much. Learn when enough is enough. Learn that balance between when you need to say no and when your body just needs to take rest. Always learn to say no. You need to ask for help. It's time for you to start seeking professional help. If you are having a persistent feeling of low mood, if you've lost your appetite, you're having irregular sleep pattern, you're having a decrease or loss of activity level, or your feelings of negative thoughts are becoming very persistent, and all these symptoms have lasted for a period of 4 weeks or up to a month, you need to be seeking professional help, going to your doctor to speak to your doctor, or picking up your phone to speak to your mental health professional if you have one. When does it become an emergency? When do you need emergency help? If your situation makes you feel like life is not worth living, if you're having persistent thoughts of harming yourself, persistent thoughts of suicide, you need to be seeking emergency help by visiting the nearest emergency center, picking up your phone to speak to your mental health professional, picking up your phone to speak to a crisis line, getting somebody to help you as a form of early intervention. If you're still watching me, I'd like to let you know that we've come to the end of today's session. If you've enjoyed this session, if you've learned something that you found useful, please like this video, please subscribe to our channel. If you have any question that you want me to answer, please feel free to drop your questions in the comment box and we'll make sure that your questions are answered immediately. And until next week when we bring to you a brand new topic, stay blessed. Bye bye.